To the first part of your question, Dr. Mary, yes, we have seen an increase in the number of Ebola outbreaks in our region. Since 2000, the year 2000, we have had 32 outbreaks of Ebola. And this outbreak, if you try to separate the time period they have happened, in the last decade, we have had 19 outbreaks. The preceding decade, we had 10 outbreaks. So we have had more than 50% increase in the number of Ebola outbreaks that are being reported in the last decade. But also it's important to note that out of those 19 reported in the last 10 years, there have been 10 of them, which is more than 50% occurring in the last 5 years. So we have seen an increase in the number of outbreaks that have been detected in the region. Now, Ebola is one of the zoonotic diseases. By zoonotic diseases, we mean these are diseases that start in animals, and then there's a spillover or a jump to humans. And there are many of them. There are many zoonotic diseases. So I'll only focus on the Ebola for now. So there are a number of zoonotic outbreaks that have been occurring, and we've also seen more than 63% increase in the number of zoonotic diseases occurring in the region in the last decade. So if we are to say, is there a direct link between the increase in Ebola and the wider family of zoonotic diseases with the environment and climatic changes that we are seeing? There have been a couple of researches that have shown a possible link between the climatic changes that we are seeing and the increase in zoonotic diseases, and for this particular case for Ebola, for instance. And one of the things that was being given, as we know, disease causation is a multifactorial event. There are so many factors that contribute. But if you look at Ebola in particular, the human factor is there. We are seeing that the population is increasing. There's increasing urbanization, and people are encroaching into the habitats of the wildlife. And there's therefore increased interaction between human and the wild, which facilitates the jump of the viruses from the zoonotic sources to humans. But also when we look at the climatic factor and the climate change, so changes in temperature and changes in climatic condition also results in migration and movement of some of the hosts of the Ebola virus. And for the Ebola virus, we know that the bats and other animals are hosts of this particular virus. So when they move from areas where, for instance, there is drought, or whether areas that are no longer conducive for them, and they move to favorable areas, they may move into an area where the human population are habiting, and therefore the interaction between the humans increases. So it therefore leads to increased frequency of Ebola outbreaks in the region. Now, finally, I would like to comment briefly on the Ebola outbreak. And my brother, Dr. Chobe, has mentioned the number of cases, but I also wanted to emphasize the number of cases and deaths. I also wanted to emphasize the fact that we have seen an increase in the number of people who have been treated and they have survived. So far we have 43 individuals that have been treated in the treatment centers in Mubende and in Entebbe who have survived. This points to two facts. One is that the supportive care that is being given by the healthcare workers is really helping, and people are able to recover. And also the fact that we have to acknowledge the sacrifice and the dedication of the frontline healthcare workers who are really putting in all their efforts to ensure that around the clock, they care for the patients that are at their disposal. So I would really would like to end with an appeal to all the people in Uganda, and particularly those who would think that they have symptoms suggestive of Ebola, that they present themselves to a health facility early so that they can be able to be supported and their chances of survival increases. Thank you, Dr. Mary.